Good afternoon, folks. This afternoon's topic A is Medicare changes before 2026. What millions of older Americans need to know. So here we're gonna go through that this afternoon for A. So here we go. As 2026 approaches, sweeping changes to Medicare are proposed to reshape how millions of older adults or older Americans access and pay for health care. These updates, some long anticipated, others newly announced, touch nearly every aspect of the program, from prescription drug costs to plan enrollment mechanics for beneficiaries, especially those managing chronic conditions or relying on Medicare Advantage Part D. Understanding these shifts is essential to avoid surprise costs and ensure continued access to needed care. Key policy shifts and what they mean. Negotiated drug prices begin. Starting in 2026, Medicare will implement its first round of negotiated drug prices under the Inflation Reduction Act. This targets a select group of high-cost medications, often used to treat conditions like diabetes, cancer, and heart disease. For those prescribed these drugs, the change could mean hundreds or even thousands of dollars in annual savings. However, this list is limited, so beneficiaries should check whether their medications are included. Part D redesigned. Part D redesign. Caps and costs sharing. Part D is undergoing a structural overhaul. While the catastrophic coverage thresholds will be eliminated, a new $2,000 annual out-of-pocket cap will be introduced. This is a major win for people with high drug costs, but deductibles and premiums may rise slightly to offset the changes. The redesign also simplifies the benefits phases, making it easier to understand how much you'll pay and when. Automatic enrollment in payment plans. To ease financial strain, Medicare will automatically enroll eligible beneficiaries into prescription drug payment plans, spread costs over time. While this helps avoid large upfront bills, it's crucial to understand the terms. monthly payments, interest, if any, and how changes in drug use might affect future bills. Original Medicare prior to authorization pilot. In select regions, Original Medicare will test pilot a prior authorization for certain services, similar to what Medicare Advantage already requires. This means some procedures or tests may need pre-approval, potentially delaying care. Beneficiaries in pilot areas should talk to providers about how this might affect scheduling and coverage. Medicare Advantage program adjustments. Some demonstrations pilots are ending and new rules are tightening. Oversight of Medicare Advantage plans, payment rates to insurers are shifting, which may lead to changes in plan availability, premiums, and the benefit structures. Some countries or some counties may see fewer plan choices, while others could benefit from lower premium or expanded benefits. Who's most affected? High drug users. Those prescribed medications on negotiated list will see the most immediate financial relief. Part D enrollees. Anyone relying on cost protections or payment plans should review how the new cap and automatic enrollment affects their finances. Medicare Advantage members. Plan changes, including prior authorizations, rules, and premium shifts, vary by county. So comparing options during open enrollment is crucial. Original Medicare users in pilot areas. If your region is part of the prior authorization test, you'll need to navigate new approval steps for some services. What should you do now? Review your plans in 2026 documents. Look at the evidence of coverage and drug familiarity to see what is changing, especially for cost sharing covered drugs and authorization rules. Compare plans during open enrollment. Use the Medicare Plan Finder and any notices from your current plan to explore alternatives. Even small changes in premiums or coverage can add up. Check negotiated drug lists. If you take expensive medications, see whether they are on the 2026 negotiated price list and estimate your out-of-pocket costs. Understand payment plan terms. If you are enrolled in a prescription payment plan, confirm whether you'll be automatically re-enrolled and what the monthly terms will be. Ask about prior authorizations. If you live in a pilot area, talk to your providers about which services may require pre-approval and how to navigate the process. Enrollment timeline. Medicare's annual open enrollment period runs from mid-October to early December. This is your window to switch plans, adjust coverage, or opt into a new take effect in January 2026. These updates reflect a broader push toward affordability, transparency, and oversight in Medicare, but they also reduce complexity, stay informed, and proactive, especially during open enrollment, can help ensure your coverage continues to meet your health needs and financial needs. Okay, guys, so that is A for you. I will be back on in a bit for B. For now, Gator Wellness. Take care, folks.